When exercising with PAH, is it common to increase supplemental oxygen to maintain adequate levels?
Thing that we see with oxygen in a person who we would, in quotes, call as normal heart, normal lungs, no pulmonary hypertension, if we exercise that individual, we expect, as I mentioned earlier, the heart rate to go up, but once they stop, to quickly recover. We expect their blood pressure to go up slightly, and then by the time they stop, to recover. Those are sort of normal body or physiologic responses to exercise. When it comes to oxygen, we actually expect in a normal person for their oxygen to increase. And the reason it increases is that when we start to exercise, you may find yourself taking a deeper breath. You may find yourself breathing more quickly. And those are things that sort of open up the lungs. They pop up little areas of the lung tissue that maybe we didn't need to use just when we were sitting and breathing. You may recognize that when you wake up in the morning, you sit up and you kind of take those big, deep breaths. And the reason that that happens is that our lungs are inside of our chest and we have our diaphragm, and that kind of is the housing area for our lungs. When we sleep or when we're laying down, the diaphragm sort of, kind of moves up a little bit and the lungs kind of smush down. They're just almost, these little sacs of air that kind of get collapsed. And when we take a big deep breath, it pops open those areas of the lung and it then recruits more of the lung tissue, and we increase our oxygen when we exercise. In PAH, the blood vessels don't work correctly anymore. And part of it is that they may narrow and constrict, and part of it is that the blood vessels become thickened. And now what happens is that the oxygen, which usually is able to move through the blood vessel wall that's very thin, very quickly. When the thickening occurs, it's much more difficult for oxygen to readily move into the blood. And so what we find is that our patients with PAH often have a decrease in their oxygen when they're exerting themselves, simply because they're not able to absorb and exchange the oxygen and carbon dioxide as they normally would. And so by turning up the supplemental oxygen, you're providing more oxygen molecules to be present to move across the blood vessel and hopefully be able to maintain your oxygen level in a normal state.